Note, it's time to talk about what's going around, and today I'm joined by Dr. James Wallace from Milestone Family Medicine. That's off Haywood Road. Thanks so much for coming in for us this
My pleasure.
afternoon. So it looks like we're talking today about upper respiratory infections. I know we've talked about that a couple of these segments in the past, and are you guys seeing an increase in that right now?
We always see upper respiratory tract infections, URIs, or the common cold. It is the most common acute illness that is seen, that people present to healthcare for. So your average American gets 2 to 4 a year. So we always see upper respiratory tract infections.
Do you see it more as we go into these fall months? 'Cause I know in the last couple of days people probably opening their windows at night. It's getting chillier, people are getting outside. Is this kind of a time of the year you see an increase in them?
Yes, as the weather gets colder, people move indoors and we spread all of our germs around. You know, getting chilled doesn't make you sick, but if you're chilled, you tend to move indoors, and then we, in closer proximity to each other, we tend to spread things around.
And when do you tell people they should probably really come in and see you guys? I know some people like just to hold off, they don't want to go see the doctor, but at what point do you say, okay, it's time to go see get some help?
Well, an acute respiratory illness, respiratory tract infection or cold, is a benign illness. It's self-limited. It usually lasts 7 to 10 days. If they're having more severe symptoms, high fever, shortness of breath, chest pain, severe sore throat, they should come in. Or if they're worried, they should come in. The main thing that we want to do is distinguish URI, which is a benign process, from something more significant that might need more intensive treatment.
And if you do have that URI, what are some of the over-the-counter easy remedies that people can do at home?
For URI, there are only a few.
Okay.
There are lots of studies looking at various treatment options. The main thing that's helpful for both parents, for adults and children, is going to be over-the-counter analgesics like Tylenol or ibuprofen.
Okay.
In adults, also decongestants and antihistamines together or decongestants alone are helpful, and not a lot else. On a more natural approach, you can use zinc. Zinc has actually been shown in studies to be effective.
Okay.
And in kids, we don't use anything until they're at least age 4, except for Tylenol or ibuprofen, because it can be harmful.
All right. Well, Mr. Wallace, thanks so much for coming in with us. We really appreciate it. And good luck. And that is it for this week's What's Going Around. Of course, we do it every Thursday, so we'll see you back here on Thursday for another segment.